I'm just going to run through some housekeeping announcements. If you have your mobile phones, please put it on silent to help with the meeting. And just to remind everyone that the meeting is being live streamed on the council's YouTube channel. So please, if you're presenting or you're making comments, please be mindful that everything you're going to say is going to be out in the domain. So if you don't want anyone to know, please don't say it. So any private and confidential things, please be mindful. I am going to go straight to apologies, and I've got a number of apologies, but we have substitutes here as well. So I know, for example, Sangeeta and Chris, we're going to go do a round of introduction. If you can tell us who you're standing in for, that also would be helpful. I've got apologies for lateness from Jasmine and Anud. Oh, yeah. Jasmine is here. So Anud, apologies for a lateness from Anud. So we're going to go around and introduce ourselves. My name is Evelyn Okoto. I'm the Cabinet Member for Health and Wellbeing and also Chair of Health and Wellbeing Board. Yeah. Do you want to go this way, Nancy?
Morning, everyone. I'm a GP. I co-chair Partnership Southwark Strategic Board with Evelyn, Vice Chair here, and also Deputy Medical Director, South East London ICB.
Good morning, everyone. I'm Councillor Jasmine Ali, Deputy Leader and Cabinet Lead for Children, Education and Refugees. Good to see you all.
Good morning, I'm David Quirk-Thornton, Strategic Director of Children's and Adults.
Good morning, all. My name is Abi Oguntukun. I'm the Director of Landlord Services. I'm standing in for Hakim Oshinaike, who is the Strategic Director for Housing.
Oh, hi, I'm Darren Summers. I'm Strategic Director for Integrated Health and Care and Place Executive Lead for Southwark.
Good morning, my name's Alistair Smith. I'm the Director of Children's Services at the Council.
Morning, everybody. I'm Chris Williamson. I'm Assistant Director for Public Health, covering for Sangeeta Leahy.
Hello, everyone. My name's Jane Hannon. I'm standing in for Ade Odunlade and Philippa Galligan at SLAM. I'm one of the deputy coups.
Hi, everyone. I'm Sarah Henderson, Director of Strategy at Evelina London, part of Guys and St Thomas's, standing in for Louise Dark.
Hi everyone, I'm Michael Parsons, Head of the Financial Foundations Programme at Impact on Urban Health, sitting in for Pete Babudu.
Hi everyone, I'm Cassie Buchanan. I lead a multi-academy trust of nursery schools and sixth forms in Southwark, and I represent Southwark head teachers.
Good morning everyone, I'm Rihanna Ebanks-Babb, Manager for Healthwatch Southwark, Independent Patient Voice Representative.
Good morning, all. I am Consuelo Maria Linforth Hall from St George's Ward and the spokesperson for the opposition. Thank you.
Good morning. I'm Marilla Gangera from the Constitutional Team.
Good morning. I'm Althea Lodrick. I'm the Chief Executive of Southwark Council.
The good and the powerful are all around the table today. So I'm really excited about the meeting. Before we begin, I want us to go to, I'm not sure what page it is on your agenda, but the plan on the page, the Health and Wellbeing Board plan on the page, which sets out our vision and priorities. And I want to thank officers that keep this in our agendas at all times, because I think it's important for us to keep reminding ourselves why we're here and our focus for the Wellbeing Board. So we have our priorities set out in a joint health and wellbeing strategy, and we're focusing on 4 aims, and the themes are a healthy start in life, healthy works and lives, and this is what we're going to be talking about, concentrating on today. Support to stay well, healthy communities, and it also lists out our duties, our statutory duties, and other things that comes to this board. So just please keep reminding yourself our focus for the board. We are the strategic lead for health in the borough, and as chair, I take this really seriously, and I think we need to make sure that when we come here together and when we are listening to reports, we're coming out with tangible outcomes. It's not just like rubber stamp reports. So just to kind of keep our focus on why we're here. Go back to the agenda. Item 4, there are no urgent items of business that has been identified. Good. Item 5, do members have any interest or dispensation they want to declare for any of the items on the agenda? Great, thank you. And we go straight to the minutes, starting on page 2 to 6. So page 2, page 3, page 4, 5, So I take it we can approve this as a correct outcome of the meeting. Agreed? Great. So can we go to the wellbeing action log? And I'm glad to see that everything has been closed. So well done, all officers, for dealing with this. So can we just take this off for the next meeting? So thank you for that. I don't have any public questions listed here. Is anyone in the audience who would like to ask a question? Good. That's what I like to see. Everything's been answered. Can we go to item 9, and that's a healthy work and lives progress update? And can I call Rosie and Alice? And I wonder, Nancy, whether as the sponsor, do you want to say anything now or afterwards?
Well, I was going to read a quick poem.
Okay.
All recognise this. It's a well-known tune, but I just thought it set the scene really nicely. Working 9 to 5. What a way to make a living. Barely getting by. It's all taking and no giving or living. They just use your mind and they never give you credit. It's enough to drive you crazy if you let it. That for me is about how health and employment come together. So just delighted as sponsor to have you here, because I think it's a really good piece of work for a sponsor to be able to oversee and promote, because I think there's some really good stuff going on.
Great.
Over to you.
I will say that Nancy is the fun part of the duo.
Thanks.
Yeah, I thought I was fun, but I think she's the fun part. So over to you, Rosie.
Thank you. Is the mic working? Yeah. So I'm Rosie Dalton-Lucas, Head of Place and Partnerships in the Public Health team, and this is
Alice Fletcher-Etherington, Public Health Programme Manager.
And today we've come to give you an update on the Healthy Work and Lives progress for the Health and Wellbeing Board strategy. So the Healthy Work and Lives priority aim is to increase access to good quality jobs, providing support to those who face systemic inequalities and barriers to employment. So that residents, older people, women and disabled people. Nancy is our sponsor for this priority, and it's a really timely look at this as Sangeeta Leahy, our Director of Public Health, recently launched her annual public health report on this topic, looking at health-related unemployment and economic inactivity. Which Alice authored, so the expert at hand. And Alice is going to talk us through some of the highlights from looking at our progress against this priority.
Thanks, Rosie. So first of all, thank you to all of the action holders who provided updates this month. We're now 9 months through the action plan reporting period, and I think that's really beginning to reflect in the level of detail that we're seeing in the progress updates and the positive outcomes that are being reported. I've split the highlights up into 3 broad aims that sit within this theme of the health and wellbeing strategy. The first is the priority aim, which is about increasing access to good quality employment. In terms of our Connect Work action, Connect Work went live in October of this year, and 16 individuals with long-term conditions and disabilities have received support since the launch. As Rosie mentioned, the annual public health report this year focuses on health-related barriers to employment, and within that report there's a number of actions that relate to how we can strengthen the delivery of Connect Work. Our local economy team have been really receptive to those recommendations, and Public Health look forward to working with them to implement those. The second is on the Creative and Cultural Skills Coordinator Programme. So the contract for this programme was awarded in November. This service will target groups who are at risk of health inequalities and health-related unemployment, and it will work with the Southwark Culture, Health and Wellbeing Partnership to make sure that individuals enrolled on the programme are not only getting support with their employment outcomes, but are also getting access to creative health opportunities that will improve their health and wellbeing. On the second area, which is supporting health and wellbeing across our workforces, 100% of our council commissioned home care and reablement providers are currently compliant with the Ethical Care Charter, and that includes a requirement to pay London Living Wage. A new tender for those services went live in September, and as part of that, all bidders will have to confirm that they meet every aspect of the Ethical Care Charter. And as part of those new contracts, there'll be a requirement for organisations to report data on staff job satisfaction and wellbeing, which isn't a requirement currently. As part of our social value framework in the council, £28,000 has been committed by contractors to support community health and wellbeing interventions or creative and cultural events since October 2024. And finally, as part of the South East London ICS People programme, since April of this year, 1,500 primary and social care staff have attended wellbeing activities across the region. Then finally, on the finals, broad overarching aim is supporting people to live healthy lifestyles. The first update on the screen relates to our healthy advertising work. A spot check that was conducted in February 2025 found that 38% of public adverts in Southwark promoted products that are high in fat, sugar or salt. Although that's by no means a minimal amount, that is lower than the other 3 national areas that were tested in Liverpool, Newcastle and Birmingham. In terms of our leisure actions, there's 2 leisure actions under this theme on targeted leisure programmes to reduce health inequalities and work to promote physical activity within communities. There's a number of ongoing work streams that are detailed in the written report, but one of those is the Reading Well scheme, which is a national programme that aims to increase access to books that support, enable people to understand and manage their health and wellbeing conditions. In Southwark, we relaunched and refreshed this programme in November. That's included making sure that all libraries are stocking all copies of the books, and new comms has gone out to primary care staff as well. On Rose Vouchers, which is our programme that provides vouchers to pregnant women and young families with children under 5 to enable them to buy fresh fruit and vegetables. A priority for that scheme this year has been to increase uptake amongst pregnant women. That's been successful, so the number of pregnant women receiving these vouchers has increased by 127% since March of this year. And then finally, on our Streets for People action, one of the outputs that we wanted to see as part of this action was about increasing uptake and engagement of cycle programmes amongst people who experience health inequalities. And as part of that, 1,700 people have benefited from a Try Before You bike voucher, and 2,500 children and adults have received cycle training. So that's some of our highlights, and I'm going to pass over to Rosie for requests for the board.
Thanks, Alice. Lots of good news there. A few requests from some of our partners working on these actions. So Connect to Work, some of you who were able to attend the launch will have come across Connect to Work. It's led by our local economy team to help people get into work. And the aim is to continue to raise awareness of this offer, and would really welcome primary care's help to do that. So if you're not already aware, please give us a shout and we'll help you find out more. Any support in terms of integration to discharge processes with signposting information would be really valuable. We know that in North West London ICS there's been an increase in self-referrals because of that inclusion in information, so welcome that. Secondly, South East London ICS Employee Assistant Programme for primary and social care staff. So the ask here has been to support scaling the staff wellbeing pilot and to assist with future promotion of activities just to increase the reach. Obviously, any other offers to support resource allocation has also been mentioned as welcome as well. Last slide from me. The other requests are around healthy advertising. So my team lead on some work around healthy advertising with council colleagues, and we're conscious that other trusts in the borough will also have space potentially where advertising permissions are granted. If you'd like to work with us, we really welcome you and your colleagues getting in touch. A joint approach to this would be stronger, of course. Rose Voucher Scheme. So you might have heard of the Rose Voucher Scheme, helping families to access fresh fruit and veg in particular. Partner organisations are asked to support promotion of this scheme. If you have any teams that could do this, please let us know. And that's included in terms of community organisations or social prescribing. Welcome more support for that. And lastly, Streets for People cycle program. So we have a pedal my wheels and joyriders scheme, which our teams would like promotion of. We can send some more details around this by Maria, if that's okay. And just a final recommendation for the board that you note progress for this update and the outcome measures and these requests that I've just read through. And if there are any steps that you'd like to identify as board members or lead officers to make further progress, please let us know.
Great, thank you. Huge, well done for the amount of work that's gone in here. Anything you want to add, Nancy, before I go out to questions? As you were talking, I was just thinking, obviously, you've got the right people around the table here to be able to help with advertising and making sure that we disseminate the information. I think it would be really helpful if we make it easy for people. So what I will request, and if you send an email to board members, listing the areas you need support with. And if you talk about advertising, I'm sure you've got the information to hand over to them so that they can advertise accordingly. And can I ask that everyone please be mindful and pick up this email so that you can support in how we advertise this. I have a question for Cassie, actually, when it comes to the road vouchers, especially because this is going to families and those with young children. Are you aware of this and how closely? Okay. So
the same with Reading Well, which I've now just had a look at. And I suppose I'm thinking, it's a question for Alistair, I'm thinking, how can we move or perhaps support Reading Well, I'm interested particularly in the families one, to make it just really available. Things like little book things in playgrounds. It's much easier than going into a library, isn't it, if you're walking past with your pushchair. Yeah.
So that's an idea.
Happy to connect with you on that.
Do we have any questions on this? Yeah.
Sorry, not a question, but just to say from on Rose vouchers, it may be that I don't know, but let's make sure we've got health visitors and everything else linked up correctly on that. So I'll pick up that email and make sure the right people are connected.
Yeah, thank you.
Thanks, Miriam.
Thank you, Chair. First of all, congratulations and thank you for the excellent report. Just one simple question is, why do you think that we are still commissioning care packages from providers who are not ECC compliant?
I'm not sure I know the answer to that one. I don't know. That's, yeah.
Thanks very much. So in terms of the Ethical Care Charter, we have a requirement that all home care providers must be compliant, and they are. With the Residential Care Charter, it's being rolled out across care homes. We pay a supplement called the Suddock Supplement so that the staff caring for Suddock residents in Suddock care homes can be paid London Living Wage. But some of our placements are out of borough, and not all those providers will pay London Living Wage because most of the people in those care homes are from other boroughs. So we paid a supplement to try and enhance it, but it's going to take some time before we can do that. The solution really is more nursing care and residential care in the borough, because then we've got much more control and influence over it. But where people are placed in either very small care homes or out of borough, we can offer it and we'll pay the supplement, but we can't enforce it. So it's on a rolling program. But the vast majority of older people, Suddock residents, are in ethical care compliant care homes, and so we're very hopeful about the impact that will have on their care and the well-being of staff working there. Thank you.
Thank you, Rihanna.
Thank you for lovely update, brilliant presentation. I guess a couple of comments and questions. So the Rose Voucher Scheme, is this something that is promoted through the Ambassador Programme as well? Because I think that would be...
Yes, they should be aware of it, but we can do regular top-ups of information.
Yeah, and the outreach sites that they do, the Vital 5 checks would definitely be helpful. And then a point on the Connect to Work. So we've met quite a few times with Kim, lovely team, and we're at events. Sorry, don't think the mic likes me. Yeah, we're planning some joint events and some network meetings with the ambassadors so that way they have a better understanding of, I guess, an opportunity for career progression. And we've also connected the team with the community service volunteering officer. Oh, it's my phone. Thanks. Sorry. Yeah, so that's an opportunity to kind of further promotion there. And it'll be helpful to have some physical leaflets because we have discussed this with some of our community partners with our refugee and asylum seeker temporary accommodation project. As we well know, refugees are usually volunteers, but this would also be something that would be helpful for them to explore because we know that the Connect to Work programme now accepts refugees and asylum seekers as well.
Thank you, Ren. I really welcome that connection, and we'll make sure to have details of how to order leaflets on the various programmes.
Jasmine?
I just wanted to say thank you so much for this work. It's really, excellent. I noticed that I chaired the multi-agency asylum seekers and, sanctuary seekers forum yesterday. And Hesse Elliott and Nick Wolf came along with the Connect for Work. So they were making sure that it's going to be well advertised and embedded in that sphere. I mean, I was thinking, I know that there's a big focus on adults, but also families. And I was thinking about, basically people will tell you my preoccupation at the moment is, one, to celebrate the fantastic work that's going on in our schools, 99% good and outstanding Ofsted rating. So that's amazing. However, just before you stop celebrating, you can't help noticing that young people are not, getting jobs. So we've got like really qualified young people still needing jobs really. So I'm just looking at the relationship between this and the wider young people services. And obviously I can see Danny nodded his head, but obviously there are young people in families which need that extra support as well. So I'm just wondering about the the linkage there.
Few things I think there on young people and employment. First of all, there's been a lot of news from national government that there's going to be increased investment in that area. So hoping that we see the benefits of that in Southwark, and in public health we'll certainly be working with the local economy team on implementing the recommendations from the annual public health report, which will hopefully help shape how that investment is used. Secondly, also money from DCMS coming for the youth transformation pilot, and they're looking a lot about how we engage young people, how we commission services for young people. So I think there's possibly some join up that could happen there to ensure that people in our youth services team are thinking about employment as a key outcome of the work that they're doing as well.
Thank you. Any more questions? Can I ask, I'm sure you're doing this already, but I think it's important for us to make sure that we are connecting with all the departments within the council first, make sure that we're looped in what they're doing, they're looped in with what we're doing. And obviously those around the table, as I said, the email will really help. But what I'll ask everyone around the table is to look at how you can promote some of the works we're doing. We are dealing with the same cohort of people, and if we are to help our community, we all have to get involved. So please, when you do get the email, think about how you can disseminate this information, who will be good to go out on the ground and spread the word. We've got better benefits. The Rose vouchers are there for our families. They should be accessing this, and we can only us and those we connect to can help make sure that it goes far and wide. So please do be mindful when that email comes out. So please make sure that you do send it as soon as possible, and make it easier for people to get the information and send it out. Great. Thank you so much. Thank you so much for your work. Thank you. Rosie, do you mind turning that off? Oh, sorry. Yeah, Alice. Thank you. And item 10 is the financial shield update. And can I ask Michael to come forward, and anyone else? Thank you. If you can introduce yourself, and then over to you.
Hi everyone, my name is Naz Biggs and I'm a portfolio manager at Impact on Urban Health.
Hi, my name's Michael. I'm currently not sitting in for Peter. We're not in this seat. I head a program for Impact on Urban Health. We're here to talk about the Financial Shield project. We'll double team this, but I wanted to start with a little bit of context. So the Financial Shield, so this is sort of the why. The Financial Shield project is something that we at Impact on Urban Health, in partnership with the Centre for Responsible Credit, Citizens Advice Southwark and AGK Lambeth, started up during the during the pandemic. And it was based on the understanding that in the same way that the effects of the pandemic on people's health was not equally patterned, it reinforced existing inequalities. So were the economic effects of the pandemic. People who were more likely to be in casualized work or low paid jobs were less likely to be supported. So we wanted to put something in place that worked with GPs and social prescribers and others that helped provide proactive support to those people who we knew were most likely to need it at a time when they were less likely to be able to access it.
So Financial Shield, you might have heard the name Back on Track, which is the public facing name of Financial Shield, specifically focuses on income maximization, so supporting people increase their benefits, debt management, applying breathing space if they need it, joint debt recovery protocols. So, for example, residents with multiple priority debts, for example, if they've got housing association debt, council tax debt, they can coordinate the repayment plans, and also referral to regulated advice services. So, for example, if there's wider debts that they may have with utilities, they also will help refer to other wide breathing space programs. We take a partnership approach. So as Michael mentioned, we've partnered with housing associations, advice agencies, GPs, also the local councils have been involved. The financial support link workers that we have, they are from AGK Lambeth and Citizen Advice, and they have been embedded across 34 GP practice across both boroughs, Lambeth and Southwark. And one of the things that's been really powerful is there's a proactive identification of people in need. So GP referrals, there's been text message campaigns, there's been leaflets in GPs, and there's also a self-referral route.
Yeah. Great. So as I said, it's been running for approximately 5 years, must be coming up to 5 years now. And we have finished this second evaluation. The first one was on the process, but this one gives us some of the outcomes. So the first point to make is that it's been £1.67 million of financial gains for residents. That's money in people's pockets, primarily from making sure that they're accessing the benefits that they're entitled to, but also through other things such as council tax support, and social tariffs where those are available. That's across 1,100 residents. Naz will tell a little bit more about who those residents are, but they, as Naz mentioned, they were primarily proactively reached based on what is understood about risk criteria, and that includes coming from GPs. And there were 350 residents which benefited from the breathing space scheme, which was a genuine local partnership and an innovation, who debtors agreed to coordinate their approach and to work out the repayment plan that was actually reasonable for the person in collaboration with their support worker.
Yeah, and one of the things that I think is really important to recognize is that we understand that certain groups are worse affected than others, especially when you think about the structural and systemic factors and demographics. And I think that really showed in this work. 62% of the participants were women, so they were the largest gender group. Most of the participants were actually working age, 57% were 45 and older, and the largest group within that were 55 to 64 at 30%. And also the largest group, 50%, were from Black Afro-Caribbean backgrounds. 25% were single parents. And I think when you start getting into the health conditions, there is a complexity there. There was physical health conditions that were identified. 92% had long-term health conditions, and some of the most common, chronic pain, diabetes, but also mental health. Around a third had both physical and mental health situations. And I think one of the things that is really important to highlight is that we understand that there's a complexity with people when they have these health conditions of getting into work and staying in work. And as we know, people had financial difficulties. A third had rent and council tax arrears. 25%, even with all of the support necessary, they still said that their income was inadequate to meet essential rising costs. I think that's really important to reflect on what's going on systemically and socially and economically. But also something that's also on the rise is credit debt. 1 in 5 had credit debt.
Great. And just to pick up a little bit more on that health conditions as well, it's particularly important to note, I think, that diabetes and depression, particularly when they co-locate, are a strong signal of that multimorbidity is on its way and is on its way fast. And somebody experiencing depression makes them twice as likely to develop many more conditions very, very quickly. So the fact that it over-indexes on people with mental health conditions is extremely important for their other health conditions as well. So what we saw in terms of outcome, so 53% of residents reported improved mental or physical health, and this is within 3 months of the end of the intervention. So we saw reduced stress, anxiety, and depression. And like at Impact on Urban Health, that is our primary aim, right? The improvement of health. There are other things that are important. So there was a 30% reduction in GP visits. Now, I have to be clear that this is emerging evidence, and we for data sharing reasons that we'll hopefully come on to later, we only have 3 months post-intervention for that. But in some cases, this is a significant amount because it was people who were visiting the GP sort of once a week in lots of cases. That is it may not be a cashable saving, but what that represents is A, people's health is improving, and B, other people are more able to access the health services that they need. So that's really important. And the clinical focus. GPs are very, very good at what they do, which is dealing with those clinical issues and approaching people's health. So the fact that an analysis, a qualitative analysis of the GP appointments that remain showed a much tighter focus on the health conditions, which leads to things like improved medical adherence and eventually saved costs to the system and people's better health in the long term. So the health improvement is what matters. The other things obviously all enable that to happen.
So some of the other key insights that we think are really important is that this offers a tried and tested model that really shows that integrating financial support and health actually works. And it's something that, we think is really, really important to build a society that gets people back to work, gets people supported with their health. As Michael mentioned, data sharing was so important between partners. The fact that the council and housing associations were able to come together and look at someone's situation and say, okay, what is going to be sustainable for their repayment? How can we enforce this better and provide breathing space where necessary really helped people in their financial situation. This comes up time and time again, but we really found that the face-to-face support was so important. And we had a launch in Parliament and we had a service user there who shared just how important it was having someone to talk to who could also speak to social prescribers and their GP. And that they could actually see such a difference having that support and someone who will sit there with them, go through certain forms that were really, really scary and really provide that additional advice. But also GPs spoke about how useful it was. We had Vic Sharma, some of you might know Vic Sharma, who's a GP that's really helped in this project. And what for me was quite important is Vic said, it actually changed our practice. We were writing medical notes in a way that was way more detailed. The information was able to be pulled out more easily for people to support benefit claims, for example. So just having that support actually start to transform practice. And I think that's really, really important.
So it's important for us to look at the return on investment, and we have a headline figure, which is the return on investment to residents for every pound that is invested. So for every pound that is spent on this kind of support, it's £3.79 put in the pockets of residents. Of course, that is primarily through the benefit system, which means that that can be politically contested, but it is nevertheless more money coming in that people are spending locally. People more able to afford their rent, more able to afford healthy food, more able to afford to turn the heating on at night. The other thing I do really want to put onto this is we've discussed data a couple of times. It's really important to have the data sharing. It's also really important to have the longitudinal data so we can actually see what happens to people post the intervention. And that was hard yakka to build, but it's been really important. That is definitely, however, an understatement of the return. Because we know from survey sources that about 50% more people received financial gains than we were able to track through the system. People drop off for all sorts of reasons. So another step for us is to be able to add more nuance to that information and to make it more rigorous. I mentioned here that there's additional social value that is not contained in that headline figure. A GP's appointment's normally considered to be at the cost of about 50 quid, but we're doing further work to try and quantify some of those additional social values as well.
So our main recommendations is mainly around, highlighting that financial advice and support is integrated into the neighbourhood health plans that are upcoming, because I think this is a perfect opportunity for us to really consider how advice and health can come together. We really think that co-located advice teams in health settings can help provide more structured referral routes and reach the right people that need the support. And we think that, the data sharing work, this can be explored further. So imagine if we also were able to data share information with utilities, water, energy, as well as housing and council tax. Like that could really support an individual that might be struggling in all of these different ways and rising debts. We think that longer term funding partners could develop a shared evaluation model when we're thinking about the social impact and cost effectiveness, thinking about the longitudinal support as well. And we think that, as Michael mentioned, this is dependent on welfare, political situations around benefits, but future welfare changes are subject to rigorous impact assessment where they actually consider the impacts for health and the delivery of services. We think that this could be something that could really transform the way people experience society, their health, and making sure that they can manage their finances. Do you want to add anything?
Great. So my mind has been ticking over very fast on that. I would like, Althea, Darren, I'm going to come to you to think about some of the things I'm going to say. So thank you for this piece of work, really informative and basically a clear example of the wider determinants of health and how we need to grapple with this. So we've heard about connect to work, so that is in train. In the council, we've got income maximisation and the cost of living work support that we have. We have the integrated neighbourhood work that is on train, also developing and working out how to kind of bring it in place. And so there's a lot of things that we're doing, but it's in silos. Different partners are doing this. And I think the main focus of the aim of the board here is to how do we integrate further? Who really is best suited to start leading this? And again, I'll come to about housing. I mean, we're doing a lot of work in housing, and it's about the data sharing and how closely we can align that. So with everyone thinking about what you're doing in your own respective organization, how do we start aligning our work? I think that the integrated neighborhood work is probably a vehicle that we could start thinking about how do we bring this together. But how fast, I don't know how we can do that. At the same time, the council is doing its work and etc. So your thoughts, Althea, on how we can start, bringing some of these things together, because I think it's really important. And I mean, with the primary care work, I'm just curious to find out, and I'm going to come to questions about it, so I'm just going to take chair's liberties. I'm thinking about primary care, how they managed to get an advice worker. I mean, was it in the surgery? I'm just thinking about space and how can this be expanded?
Yeah, so there are two models that have been trialed. One is co-located in the building. When you go to visit the link worker, it's in one of the surgeries at the office. Another one is just integrated referral routes, so citizens' advice using their own premises. There are advantages to each, and one of the things is being able to look at them. But to the neighbourhood point as well, of course, the actual physical infrastructure of how they're constructed, the actual buildings, is in large part what defines whether you can co-locate and to what extent you can co-locate. So making them future-proofed feels very important at this moment.
Thank you. Questions? Darren?
A question and a short comment. So a really good report, and absolutely support the kind of suggestion that we integrate this into our neighbourhood health plans. Whether we integrate it into neighbourhood health centres, I think you've just said it is a slightly different matter, because at the moment we don't have 5 obvious health centres that we could locate integrated neighbourhood health and care teams. However, there are, for example, next door to some of our health centres, some really good other public sector facilities, including things like libraries, in which you might be able to locate some of these services. I don't want to jump ahead and commit us to anything, but absolutely support that recommendation, and we'll be looking to take that forward. It's probably worth us just saying here that the neighbourhood health plans are developing in stages, and at the moment the first focus is on bringing together some of the health teams, but next stages we'll be looking at the wider preventative areas of work that those teams will be able to deliver in conjunction with the voluntary sector and a range of different partners. The question I had was just, so we currently commission a number of welfare advice workers, for example. I don't know if you have it or where we might be able to source it, kind of comparative information, or if you've got any sense of, is there something very different about this model compared to, for example, a welfare advice worker that's located within our mental health wellbeing hub, and the effectiveness of these two different models? Because we do commission quite a lot in this area, and what I think we're all obliged to try and commission most effective things and utilise the resources we've got most effectively.
Yeah, probably too much detail for right now, but we do have a bit of the comparative point. We think that this is at the the returns are within the range of what you see, probably at the higher end. The cost is understandably, being London focused, is higher compared to the average national cost. But that comparative piece is, we hope, forthcoming, including with what happens if you do basically this in a mental health trust setting, so different parts of the health system as well. But yeah.
I think one of the elements I was thinking about is how do we take out a number of duplications that we have in the systems? Because I mean, this report is really good, and you kind of showed what has been working, but equally also there are other things that's happening within the different partnership, and we need to also evaluate whether they're working, and actually which one is the one we should all be focusing on. And I think I'm not sure, part 2, are you doing a part 2 to this report, as in trying to kind of weigh up the different models?
Yes, as to how comparative it'll be, I can't say exactly what it is, but yes, it's going to be a deepening and nuancing of that information.
And Jasmine?
Yes, thank you very much for this. I mean, it's a strong reminder that actually financial worries do literally make people very sick indeed. So obviously children's services, are exemplary, in providing early intervention and prevention. So how can we hardwire this with our family hubs, really, which is about delivering early intervention and prevention?
I mean, the answer is yes, let's, and that includes other sites as well. Food banks, which is there's a related project that does that as well.
Thank you. Oh, Alistair, do you want to jump on that one?
I was going to overlap really with Councillor Ali's point. That's Director of Children's Services. Just a quick reflection, a question, a suggestion. I was really pleased that the single parent focus 25%, but of course you've then got 75%. I imagine a lot of those are parents as well.
Yeah. Yes.
So I think one of the challenges around public policy as well is not being explicit about family context, about parent context, because these are additional pressures.
Yeah.
And sometimes we have it seems to be competing public policy at a national level, integrated neighbourhood teams and family hubs, for example, and that we're speaking about the same thing really. And often there's overlapping residents who are trying to help and support, because we help these parents, we also help their children, and children have challenges as well and affect their life chances. So that was a reflection, and the question is really, I think it was Councillor Ali's question about how you can profile that. I think we need to set that in higher relief to play back to government so that communities are really clear we're trying to help them in their context as parents, as well as having long-term conditions. I think it's a huge challenge, and the offer is, the suggestion is that we have to do a lot of work around family hubs. We are trying to work with the health system around integrated neighbourhood teams, and I think we can have a conversation outside around that, because, for example, we had a long-term programme around what was called Troubled Families, is now Supporting Families, and a lot of that is about employment aspects to that. So I'm sure there's lots of overlapping interests, and it's unrealistic for us all to co-locate in the same place, but it's absolutely realistic that we understand who is doing what where, and that where residents come at their point of need, they might go 2 or 3 times to a GP about their manageable long-term health condition. They might go every day to a school, every day to a childcare setting. So the knowledge of that system and how we help residents to navigate that, and not just over there, how those that need more help are helped to access, I think is really important. And I think we can have the conversations outside about how we put that together.
That's a really good point. And I was just thinking, actually, for example, you have one resident who has touch point with probably everyone around the table: health, schools, VCS, council. And this one person, we're all trying to help them in different ways. And some of it is duplication. But yeah, if we align and think about, okay, then what is the need of this cohort of people, and how can we streamline the support? I think collectively, we'll be in a better position. I'm going to come to Nude, and I'll come to you next.
Thanks very much. It's really clear. And just to pick up, I think it is so interesting. I think we have to be a bit careful that people are all different, aren't they? And they're individuals, and actually they come in at different points of the service. And what we sometimes think of as duplication is actually just people finding the right route for them. And the route that they trust, and sometimes that's through community word of mouth. Obviously, we see it a lot in the VCS and through the health ambassadors. And that doesn't mean that it shouldn't be more joined up, because it's confusing for people. But I think just remembering that people are not one size fits all, and that they're individuals. And actually, one of the things is quite exciting, I hope, about the neighbourhoods model is that we can look at people in the place that they are and the services that surround them as individuals, and think about those relationships with health partners, with family hubs, and with the VCS, because I think often people, as I've said before at these meetings, people are less trustful of authorities, and so there is a space, I agree, for all the different bits. I thought it was such an interesting presentation. The demographics are really interesting, and actually that cohort of women, they will also be dealing with older parents that they're caring for as well. And so, those kind of particular pressures on that cohort. And again, just speaking to some people in that cohort would actually, I think, be really interesting as part of, what's the bit of the system that works and how does it work? I had 2 questions. One is more coherent than the other, I'm afraid. The first one is just, I suppose it's that way in, isn't it, point that we're all kind of getting at. And certainly we see with, Community so that we've got 1,200 VCS members, and they range massively from, a tiny community group through to a big registered charity like Age UK or Citizens Advice. But clearly people are coming in through there, and they may not actually even be accessing the GP or stuff. So just thinking about, I think what's really exciting about this model is it was kind of identifying people coming to the GP surgery. But I suppose, what about the people who aren't, or how are we kind of the reverse of that, people who need support with health but aren't coming through. And again, I think neighbourhoods is probably an exciting way to think about that. So it's not really very coherent, but a sense of like where that the other routes in work. And then the second question, which hopefully is more coherent, is just that you've obviously funded this pilot. What's next?
I'll start with the first one, I think, and one point about FinShield as well is that the primary way in is through GP services and through proactive outreach, actually. And what you definitely find is that for at least some people, for at least some of the time, a GP surgery is one of the most trusted environments in which they'll reach. That will not apply to everybody, but it does apply to plenty of people. But there are also other referral routes in. So one of the investments that's made here and now can be made available more widely is a referral architecture through data that can in theory be used by anybody, and it anonymizes and yet identifies individuals, so to be able to track that outcome through different access points is really important. This is a public forum, so what I will say is what's confirmed about the future of it, which is that it is currently funded till the end of the financial year, and we are very hopeful that we expect it to continue beyond that. But
I've got David next.
Thanks very much for the excellent work. Really, really great and sobering to see. I have a question about the data, and if it's possible, as you go forward, to see if the folk that you're helping are also carers. So we know that some people are registered with their GPs as carers, but I suspect there may be quite a significant number of carers in here, and therefore the best solutions for them may be work, or maybe a combination of work and support. And I just worry that if we don't kind of dive into that space a bit, we may be missing an unmet need. So if it was possible from the data to see who is registered as carers, then that'd be an area we'd very much want to catch. And my other question is if it's possible that we take the learning from this about synchronicity of support. So if I've been swimming in a sea of depression and anxiety, and money has been a big factor of that, when I get this help, may be a very good point for me to then have talking therapies or some other input. And I'd really like us to be challenged on those optimum moments to help people, because otherwise we can help someone in really, really important ways that we are, but we may not be taking the opportunities. And I'd quite like us in social care and in health to be challenged with kind of timely synchronicity of support as well as the financial support. And I'd be really up for looking at that. So any learning that you have, that you've helped someone get to this stage, but actually they're then on a waiting list for social care or health services for another year, is not really helping them. I'd really appreciate if we had any learning come out from that in terms of feedback from people about now would have been a good time to help me. So please could you do that? So just any other wider learning that comes from it. But thanks so much for your work.
thank you. We'll definitely follow up on there. Yeah, the right support at the right time is key here, isn't it?
Great, thank you. And I'll come to you.
Yeah, just to comment, really, really interesting presentation, and it got me thinking about this question of families as well, obviously from a Evelina perspective, and the work that the integrated child health teams are doing in that proactive searching of children with biopsychosocial needs and how we can connect that together. So I guess an offer just to be part of that conversation, and lots of things I think we could do and help.
Thanks. And I think from this discussion as well, it's important, certainly for us in future. We said 1,100 residents, we mean 1,100 households, and it's not just the person with whom the service interacts, right? It's important for us to recognize that.
So I hear an action coming along for people to get together and to kind of take some of the learning forward. Great. Nancy?
Hi, thank you very much. It's really interesting to read. I wanted to highlight to everyone that in our joint mental health and wellbeing strategy is an action which Partnership with Southwark is holding to do a bit of a survey of the social prescribing offers in the borough for mental health. And the reason I think that is so important is what you're presentation has completely highlighted to me is there's just an awful lot out there, and it isn't very well coordinated, both from its commissioned perspective, from its provision, from its monitoring, from its joined up working data sharing. We know this, and we talk about it a lot. I think you've articulated it very well, Anud, about people need people are different, they need different pathways, but actually we've got a constrained resource. We can't just have hundreds and hundreds of pathways. I actually have never referred anyone to you, as far as I know, as a local GP. I think I'm in the wrong practice, but I have referred hundreds and hundreds of people to our social prescribing link worker service and the Wellbeing Hub and Age UK and directly to Citizen Advice Bureau and works that, it goes on and on and on. And I'd really like it to be easier than that. I don't want to remember all that list. I want my patients to be able to navigate that. And I think they need to navigate it outside of health settings. I do appreciate you saying that it's a great place to capture people, but we also have a rationed amount of money. We need to be doing what we're really, really good at. We can identify the problem, absolutely, but I think we need the pathways for people to be somewhere else.
Althea?
Thank you, and thank you from me too for the presentation. It was sobering, but sadly not surprising in some ways. But I think that's a reality. I'm really responding to you, Chair, in terms of the sort of call to action that you made at the outset, and to say there is work. We are doing work in the council and with partners on about thinking about our operating model, how we invest our time and resource, and what has come to the fore, has always been to the fore, but has come even more glaringly to the fore, is the need to really promote and elevate and amplify investing in prevention, and investing in prevention in a way that provides us with this measurable outcomes. And we're thinking of that across the board, so not just thinking about that from in housing, in care, in resources, but how we as a council, as a part of a system, operate across all of our levers, really, to make a tangible difference, to really have those, to ensure that the huge investment that is made across that piece, and frankly a reducing investment, is invested in the right way. So I think in answer to your question, is that something we're thinking about? It absolutely is. And as I said, that investment in prevention, and this is very much about that, I think is very much at the top of our agenda as one of the overarching principles that will drive the way that we move forward in an increasingly constrained environment. So it's really to respond to say, yes, that's what we're doing, thinking about. Thank you.
So I think at the end, I will kind of summarize the kind of action I'm hearing from the discussion. I'm going to go to Maria and then Cassie.
Thank you very much. I think it was a very interesting and informative presentation. Just I have two questions, if I may, Chair. The one is, what are your plans to ensure that data sharing agreements extend to energy and water providers as recommended? So that's one of the questions. And the other question is, what commitments are GP practices making to ensure sustained referrals rather than pilot-driven picks?
Sure. Do you want to? So on the utilities, that's ongoing work. One of the challenges with place-based work is when the place does not overlap with the footprint of a utilities provider, even Thames Water, which is obviously the most geographically constrained. It becomes a more difficult request for them. But we remain hopeful, particularly with water, to be able to, and Thames Water have actually run trials in other ways and in other parts about sharing data on, for example, universal credit. People in receipt of universal credit should automatically get access to social tariffs through things like through Thames Water. So there are current trials going on to see how that can work in practice. But I will not it is definitely true that it is harder to say, oh, this is based in this part of South London when you're dealing with, British Gas or whoever it is. Sorry, I missed the second question.
So what commitment are the GPs making about referrals, essentially?
So there's no contractual commitments. Part of it is demonstrating the value of these through taking them into a different setting, into an advice setting rather than into theirs. There has been no shortage, I suppose, of commitment in those surgeries to make those referrals. Again, that becomes once one starts to expand these things, and we do hope it will expand. You might get slightly varying levels of commitment, but that's not the experience today.
And obviously, this was a pilot. Okay, and I think the question, I believe it was Rhiannon asks, what next? Because obviously there's been a lot of suggestions about how you can expand this work and improve it and help the kind of the wider team, identify certain areas. So the question to you now is, okay, you've done the pilot, what next? And how are you going to be able to support partners in taking some of the recommendations forward?
What next is a live discussion. I'll be honest about that. The intention is for us to be able to share these learnings with other agencies and organisations who are doing so, with other GPs, with other areas. So, for example, there are places in other parts of London who are picking up on this, and we're sharing the learning there as well. It's a live discussion as to what's next in place, which we are very happy to pick up, but perhaps not here.
Great, thank you. I think what I'm hearing is that there's going to be onward discussion. Alistair, you're going to meet with Michael, and I believe Anne, was it Anne at the end? Lady at the end? Sarah, apologies. Sarah wants to be included in that discussion. I think it would be also interesting to meet with our the officers are working with Connect to Work as well, so that we can kind of iron out some of the duplication in the system. But I think if we can start having that discussion to see where we can take some of the recommendations, I mean, admittedly, we can't do everything, but what we can do now, if we can get together and see how we can support one another, that would be helpful. Anything else before we move? Oh, sorry, Cassie. Yeah.
So it's a quick one. I hope it builds on what people have already said. So I've been looking at sort of place-based work in relation to children, but actually I just run into the same challenges that we've talked about here. And one of the areas in England that seem to be doing it really well is Sunderland. And they had tackled this through the kind of lens of children and through taking the health ambassadors model and creating a family parenting ambassadors volunteering model to do all of the signposting whilst based in schools and colleges, which I thought was really interesting. It's something I'm thinking about. And so I guess my question is, you mentioned sharing your learning with other areas. Is there anyone doing this, any area doing interesting work in this space that we could learn from, in the way that I've given you an example, but any other examples of people who are further ahead that perhaps could help this?
So there's a really interesting model that has quite a lot of evidence that's going on the they've changed names because they've merged, but it's Portsmouth and the Isle of Wight, that sort of area. That's I think one of the more progressive versions of this in the country. So that's really interesting. There are some other interesting models around in Liverpool as well, which are doing similar things. So there's a lot going on. I say there's a lot going on. There's more not going on than going on, but yes, there are lots of interesting attempts to solve similar problems that we've tried to fold into this as well, and that I think are of wider relevance.
And just to add that another connected area is the work on health justice partnerships. There's quite a bit of research that's been going on around health justice partnerships, thinking about different types of advice and how that connects to health that I think would be relevant. I haven't got the exact example off the top of my head, but that's definitely something that we can share, because Centre for Responsible Credit have been working with someone who's a researcher that focuses on that type of area to think about where that evidence crosses over.
Thank you. A last question to Anud.
Yeah, just to be really clear, I suppose, on the next steps, because I think there's definitely a conversation about children's, isn't there? And just that point Cassie was saying, the council does some really good parenting support. One of our health ambassadors works with that team, and it's really powerful. So definitely linking that in and enabling them to offer debt advice. But then it feels like there's a wider action that people have kind of touched on around all these different pathways or stuff being commissioned. And your recommendation 4 talks about a shared model for evaluating the impact. So is that essentially what that's getting at? And can the board here at least commit to supporting that recommendation, which is around understanding? Because I mean, at the health and housing event a few weeks ago, there was somebody from Housing First on my table, and they were giving brilliant holistic support for individuals that included not just housing, but debt advice and going along to appointments and job interviews with people. So as you say, just kind of almost an analysis, or I hate to use the word mapping because everyone always wants to map everything and it never works, but just that's, you know, bringing all those partners, that recommendation 4 about like what is going on in this space.
Yeah, that would be great, because it's not just what's going on, it's what are the metrics and the outcomes that different partners value, which, yeah.
And I'm just going to build on that, just following on your point. This specifically looked at debt, but we have other projects that focus on housing, and we have a partner that does person-centered housing support. So yeah, definitely think that there's something about the advice and support sector as a whole that we need to start thinking about in terms of the touch points and where people are getting access support, and you know, how can we make sure that they're getting holistic advice around something and making sure that it's tailored to their needs.
Thank you. Thank you for a really interesting conversation. Can I also recommend that you touch base with our cost of living support department also, because I do a lot of the work you've been saying. So thank you so much. There's an action that's come out of this, and I think, am I right in thinking that there's going to be a part 2 to this work? Or okay, there will be, and hopefully we'll get it back into it. Okay, great. Thank you for your time. Thank you.
Cheers.
So I'm going to move on to item 11, and that's SC1, and Danny and Helen. Great to have you, Helen. So just to say, you're going to tell everyone about SC1, but I'm really proud. We were at the second launch event at the Shard, which was really good. And SC1 is about Life Science Innovation Districts, and you'll talk more about it. But I'm really proud to say that Southwark is one of 7 founding members of SC1. And what I really like to tease out of this presentation is about the benefit that it's going to, our communities will get from SC1. Thank you.
Thank you very much, Chair. And actually, before we begin, may I say very briefly that I've been sitting in the audience getting a warm and fuzzy feeling in my stomach at the number of mentions of Connect to Work at this discussion. I think it really speaks to the work we're doing on integration in that space. So thank you. So yes, we're here to present today about SC1 is our new logo there, which has been a program that's been in train for a number of years, but has actually just recently really hit a much more exciting phase, I'd like to say. And I think, yes, community benefit. This is all about, if we get this right, this could absolutely be transformational for the communities of Southwark and Lambeth. So I'm Danny Edwards. I'm the Assistant Director of Economy here at Southwark Council, and I'm here presenting with my colleague, Helen.
Hello everyone, I'm Helen Santa. I'm the Head of Partnership for SC1 London. So as Danny said, we're very pleased to be presenting under our new brand, which was very warmly received at our reactivation event at London Life Sciences Week. some of you will probably already have come across innovation districts before, but I thought it might be helpful just to give a very quick run through just for the uninitiated. We're in good company. There are lots of these across London, but also international examples as well. And essentially, it's about cultivating an ecosystem of people and places and partners to promote innovation, in our case, within the life sciences sector. And I think critically as well, we differentiate ourselves a little from some life sciences districts in that we refer to ourselves as a health and life sciences innovation district as well, really sort of bringing to the fore the community benefits that we would like to see on a local level that can be supported by fostering some of the world-class innovation that's going on in the sector.
So, Evelyn, you mentioned the 7 founding partners, which includes both Southwark and Lambeth councils, as well as hospital trusts, including Guy's and St Thomas's, King's, and the South London and Maudsley. The partnership also includes the Guy's and St Thomas's Foundation and King's College London University. So, a real triple helix partnership is the word in vogue at the moment that represents sort of private sector, the public sector, and the education sector. The clusters themselves have three distinct geographical locations, including London Bridge and the new Snowsfields Quarter, which has recently received planning permission. I'll talk more about that in a moment, as well as St Thomas's at Waterloo and the new Royal Street development, and also a mind and body cluster at Denmark Hill, focused on both South London, Maudsley and King's. We have a new team in place led by Helen, and currently working on a refresh the SC1 strategy. And as part of that work, we've identified 4 key pillars, including innovation and enterprise, place, networks, and community and talent. And we think it's those 4 pillars working together that will bring about the kind of the transformational impact that we're hoping to secure.
So it's a very timely opportunity for us to be able to speak to you today because, as Danny said, our strategy is undergoing a bit of a refresh, and we are very much in listening phase with both the sort of founding partners, but also other organisations that feel that this is something that will be of relevant to them and helping you achieve your objectives. I was going to give a run through of our sort of thinking around these 4 strategic pillars initially, and I think with a particular reference to how these could potentially link in with the objectives of this board. So as Danny mentioned, we have 3 innovation clusters, and there's a huge amount of innovation coming out of all of them. Pretty much every clinician or academic I meet is working on a really quite extraordinary piece of technology or a new app, particularly some very interesting stuff coming out of Denmark Hill around a sort of app-based technologies that can support people with long-term mental health conditions or cognitive issues. So there's no shortage of that coming out from the universities and the hospitals as well. But we're not alone in this. There's an issue nationally with converting that innovation through spin-out stage and actually into kind of reaching the patient. There's long sort of complex processes in terms of kind of regulation and the like, which you'll all be very familiar with, and we're looking at where that gap is and what we as SC1 can do to support that process of getting these products through to market. So there's the London Institute of Healthcare Engineering up in Waterloo, which offers a lot of very kind of targeted support in this respect, and some very interesting proposals to look at extending that towards biotech as well at the London Bridge campus. So I should also say a lot of these terms are kind of not necessarily familiar to everyone, and I think another thing that we're really mindful of, particularly when we come on to community and talent, for example, is the importance of being careful with our language about these terms. There's huge numbers of sort of career and other opportunities in this sector, but if you hear medtech and biotech, it sounds a little bit I don't know what it sounds like, but it sounds certainly beyond my intelligence. And I think what we're trying to do is kind of break down from a community perspective what that means in terms of routes into the sector. The second focus we have is on place, and I think, you know, I'm particularly interested in this. I used to run the business improvement district in Waterloo for 10 years, and the point where healthy place meets health is of real interest to me. And so there's some flagship developments that have been approved and are coming forward, such as Danny mentioned at Snowsfield. There's also a large development coming forward at Royal Street over in Waterloo, which have the opportunity to attract significant new health and life sciences businesses to the area. There's benefits for the council and the local area in terms of kind of new investment and Section 106 and all of the activities that can be funded through that. But I also think it's really important that we're not just looking at the buildings, but also the places in between, and building on some of the work that the local partners are doing in that respect to look at how that links into the sort of overall ecosystem of a healthy area. So in particular, looking at the work of the Business Improvement District, Team London Bridge, who are Southwark-based business improvement district, have a policy around a healthy approach to placemaking. So this is really kind of forefront of people's minds at the moment about how healthy places can help in attracting new businesses to come to an area and support with staff retention and the like as well. And I think just finally on that, we're doing some work around mapping what the demand is for space and also where that space is. There's rather a lot of it locally, some of it sat vacant, and I think there's quite an interesting sort of brokerage role for SC1 in linking up the organisations who might want to be based in the area with that space that's available. And then briefly on Snowsfield, which I think Danny will talk about in a bit as well, recently received planning permission. It's an enormous development, 32,500 square metres of life sciences space, with some sort of community benefits alongside the new workspace. I think at this point I'll hand over to Danny to talk a little about the sort of jobs and benefits from that.
Yeah, I mean, I think the Snowsfield development, which has recently received planning permission, probably needs not much introduction at this board actually, but this is a real catalyst for SC1 in Southwark. This is really going to be almost like one of the focal points of how we're going to secure the community benefit from what is quite an abstract term for many of our residents. And the developer Oxford Reef have actually partnered with Morley College, a local higher education provider, to offer a community engagement and learning space on the ground floor of development. So that it really is anchored in the community, and communities are able to kind of engage with the building, engage with the place, but engage with the sector and learn about the sector and really start to build that science capital locally amongst our residents. It's also going to generate a lot of affordable workspace and Section 106, £2.7 million worth of Section 106 for community benefit as well.
Brilliant. And then our third theme, which is networks. This is really cross-cutting, but I think, you know, we see there's an important role for SC1 as a convener, and also as an organisation that can really help amplify the amazing work that's going on currently. So my colleague Louis Vine, who has joined on secondment from the Guys and St Thomas's Foundation, is leading on comms and engagement, and there's a brilliant story to tell in this area about the innovation that's taking place, not just in healthcare itself, but across the piece, in terms of the interesting work as well that's being done around public health as well. And I think as part of that, we're kind of exploring at the moment where we can be most useful to our members and you as partners in amplifying the work that's going on in the area.
And then the fourth pillar of the strategy is community and talent, and this for me is where the kind of community impact benefit really comes alive. Before I talk about the work in that space, just a bit about the opportunity and the challenge here. We're talking about a huge number of jobs once sort of SC1 reaches what we call a steady state, when it's sort of at its peak, if you like, in terms of activity. We're talking about an additional 33,000 jobs across the patch, and those are jobs at all skill levels, not just lab technicians and scientists, but actually what we call indirect and induced jobs as well, through things like supply chain and support firms. We all know the challenge in the scale of the challenge in Southwark. Very high levels of unemployment, above the kind of the London and national averages, and also higher levels of economically inactive due to a long-term health condition. Chris, you might recognise these tables from the excellent annual public health report. And just something about the sector itself. It's not a very diverse sector. Less than 1% of the sector is from Black Afro-Caribbean communities. That's not representative of the community of Southwark. And actually, if we're serious about making the sector work for our local communities, then that's not sustainable locally, and that's something we'll look to tackle. And so the community and talent strand is all about that. And we've already got a skills and employment action plan, which has been developed across the whole partnership, not just the founding partners, but the two local authorities working with the healthcare institutions and local employers. HE and FE have kind of come together to really kind of map what a program looks like to kind of support Southwark and Lambeth residents into opportunities at all levels, looking at work experience, at paid internship opportunities, at jobs and careers. And that's kind of the aspiration. We have secured £200,000 across the two boroughs to pilot some activity specifically around work experience and paid internships. And in the fullness of time, we'll be looking to scale that up and scale that out. The ambition is to have sort of a cohesive offer, so that if you are an employer of any size looking to be part of SC1, we'll have a service that will work with you to make it easy for you to be here, to make you want to be here, but also to work with you to understand what opportunities you're going to bring and how can we support local residents into those opportunities. It's not only about jobs and skills, it's also about health equity as well. And Chair, we've had lots of discussions around what that looks like as well, and things like the spin outs from the innovation and enterprise strand. How will those new technologies benefit local communities? That's something we'll be very keen to explore. Just one more point. The GLA have recently commissioned activity around sector talent boards, and one of those sector talent boards is in life sciences. So we are looking to partner across the central London clusters to tender to that work, to make sure that we have a seat at the table in terms of what that employer engagement and sector talent activity looks like. Oh, and finally, a couple of weeks ago, it was London Life Sciences Week, and as Helen has mentioned, we had our relaunch event, which actually wasn't the highlight of my week, despite it being a fantastic event, because also in the same week we had a spotlight event for young people to engage with the sector, and so we hosted a whole number of schools from both Southwark and Lambeth. 100 schools, there we go.
100 young people.
100 young people. To engage with, to really talk to them about SC1 and what it means for them, and what opportunities look like. And yes, so the highlight of my week was sitting down at a table with some school kids from Elephant and Castle, extracting DNA from a tomato. Thank you.
Great. Thank you so much, both of you, for that update. I am really excited. And I think, Danny, you've been listening to me quite a lot. So you've said a lot of things I would have probably come back with. So thank you on that. I think I mean, SE1 has got to the point where I'm happy because I think the first iteration for me wasn't tangible enough. We're still going to wait, as you say, talk about communication and the language we use to make sure that it's kind of broken down so our residents and community understand. So I know this work we need to do. So, but thank you for where we are now and for the experiences that our young people are getting from SE1. I know, and I'm going to come to questions about just a question for me. I know we're focusing on the 14 to 16-year-old because obviously I think that's the age group that are thinking about careers. But I think it would be really good is how we inspire the younger generation, how we go into schools to be able to kind of showcase what we're doing, because we were talking about a talent pipeline actually from the schools is where we also need to think about as well. So I think one last question for me, which, the jobs and careers that we're creating in SE1, how are we going to kind of disseminate that information? Who are we, going to link in to make sure that residents do know that you're there, or SE1 is there, and that there is a pipeline, that there is, opportunities there? How are we going to do that when we talk about communications? Any other questions? Cassie? Cassie first.
Yeah, it sounds great. I suppose timely, and we've just launched this year our first post-16 qualification in applied sciences. So that's at East Dulwich. We were thinking of the sort of Denmark Hill area, that maybe there'll be sort of opportunities there for people to go in. But what I was going to, so there's that, and that builds, I guess, on that question around how you can communicate with secondary schools so that we make sure that we're offering the right post-16 qualifications. Obviously, it's great to be working with colleges, but most of our students are in secondary schools, in sixth forms in Southwark, so it'd be really good to sort of think about that. And then there's an opportunity here, obviously, because the national government has obviously just published the curriculum and assessment review, and I was part of that. And one of the recommendations that we made was the launch of V levels, so vocational levels, and that sort of in development at the moment. And post-16 colleges will be involved in what that looks like, and the things and the qualifications that are going to need to be important in particular places. And it sounds like a V level that actually feeds and provides opportunities for young people in life sciences, and the sort of technical aspect of the world of medical science and kind of broader biomedics would be really exciting. So I guess it's just a nudge to you to sort of stay connected to that kind of more future thinking conversation.
I'm going to take all the questions and we'll come back to you. So I'm going to go to Anud, Alistair, then Chris.
Thanks very much. Really interesting and good to, because I think the last time I touched was ages ago. So amazing to see how it's going on. Few sort of small points. I think you're so right about the language. I mean, I have to confess, I'm still not sure I entirely understand what life sciences means, let alone biotech. And I just think in any presentation being really clear, because it is hard. I think, well, it isn't hard, I suppose, but it feels hard when you're so agree on the language point. And I suppose linked to that, I was looking at the bit you were saying about networks and engaging community partners. And I think it's been really hard for the VCS to engage in the conversation so far. And I suppose that's partly about language, but it's also the fundamental what's in it for them, or like, so that kind of, and I'm happy to pick that up offline in terms of a conversation around how we can get charities and community groups in the borough more engaged. And then the jobs piece, again, I don't know whether there's some learning for where, I mean, I've been around way too long now, where you get lots of stuff where you're like, there's going to be this new development and there's going to be loads of local jobs. And I don't know quite how it translates. I mean, I was at a meeting around the Blue the other day with big local, Grey Star's a big development, and a lot of the kind of tension in some of the communities, jobs aren't going to locals, housing isn't going to locals. And so just whether there's any learning from previous, big projects around, has that translated into jobs? And if not, why not? And kind of really thinking that through, because I think on the jobs piece and the benefit for the community, it's so essential, as you say, we're a borough that has loads of wealth, loads of employment, and yet our residents aren't always seeing the benefits of that. And that's not to say it's not happening. It's just, I suppose, people understanding the evidence and the learning from it. And then just the final very small point was your point, Helen, about space. So we have a VCS premises project because one of the big challenges for charities and community groups in the borough is space and access to space. And we have a member of our team who's very good at doing some matching. So in terms of groups looking for space and need out there, but also if you're doing some of that thinking, it may be there's some opportunity for charities and community groups in that. So again, happy to pick that up separately.
I know there's a lot of questions, but I'm still going to take the last two. Okay.
I was probably going to answer one of the questions, and possibly you might have been saying this, Danny, but responding to Cassie, that we are in the process of setting up a strategic conversation around 16 plus, and that's really responding to what we've heard from this actually 16 plus sector, so the college and South Bank Academy University, and I think the I think the council is uniquely placed to bring people together, but I was also curious about listening to that convener role and whether actually there's interest to support us further up the pipeline, really, because I think there's some fantastic work that goes on, and the example that you gave, Cassie, but there isn't necessarily the coordination of that, and you've got less young people in the borough in primary, and that's coming into secondary. So how can the sector work together to support those young people into employment and not be competing against each other? And I think there's real opportunity there. So we're absolutely going to do that. You're aware of that, Danny. You're involved in us setting that up. I thought I'd probably be helpful to speak to that point.
Thanks. Really interesting presentation. So thanks very much. I guess you mentioned halfway through around the kind of lack of diversity in this sector. I think some of the work you're doing in terms of kind of engaging with young people and thinking about engagement with local organisations like the BCS may help that. I'm just wondering what else can we do as a partnership to kind of build on that work and make sure that people getting those jobs are representative of our community as much as possible.
Chair, I promise. First off, age range. Yes, absolutely a focus on young people, but a focus on young people plus. There are other groups out there that will benefit from these opportunities, and we want to make sure that actually we've got an all age offer, and an offer that's quite distinct for specific age groups and specific cohorts. So and I think that's recognised in the employment and skills action plan that's already been developed. There was a number of questions on a similar theme about how do we engage the right communities, how do we make sure that communities know about this and are able to engage, how do we make sure that we use those mechanisms to challenge the sector itself to become more diverse, particularly if it's going to kind of be representative locally, and a challenge around the integration between employment support and employment brokerage and kind of skills and education. I think there's lots going on in this space already, so we're not building from a kind of a blank sheet of paper on this. We've already talked about Connect to Work, which is transformational in terms of engagement with the community and the community sector and with health partners, and I think actually that's a model that we can really build on for the infrastructure around SE1 and whatever that looks like. I'm not necessarily talking about something new, a new employment support project for SC1. It's about how do we use what we've already got and make sure it's skilled up for the opportunity that kind of SC1 presents. We've got Southwark Works, we've got Connect to Work, which is going to be delivered as part of that of Southwark Works. That does amazing stuff. 85% of the clients are supported by Southwark Works from our Black and ethnic minority communities. So that will translate into a more diverse sector if we can persuade employers to join us on that journey. And I think part of SE1 and all of the partners working together is that actually it gives us that leverage over those employers. We've also got our own local skills plan and skills strategy, which prioritizes SC1, prioritizes life science, and that's part of the SC1 ecosystem as well. So there's always more to do. We can always do better, but we're building on a really strong base for that, I think.
Thanks, Annie. Can I just add about the point about engagement with schools as well, because I think that's a really interesting one, and actually, you know, it's hard to sort of overstate how enthused that group of young people were at the Pathfinders event, and just the energy in the room was fantastic. And we spoke to some of the teachers that accompanied that group afterwards, and we got a very strong steer that this sort of train the teachers about what the needs are from an employer side is really important, and can we get employers into the classroom to talk in kind of real terms about what that means. The other thing we heard very strongly was, and again this links to the sort of language, and is this a sort of highly technical sector staffed entirely by very clever people? I mean, there's extraordinarily clever people doing clever things in the life sciences sector, but actually there's a whole load of roles as well. And some of the young people who attended the panel spoke very passionately about the fact that the biggest barrier to them was that actually they'd kind of got their way through school, got the relevant science qualifications they wanted, and then they arrived at university and they felt at sea because they were surrounded by people with very, very polished soft skills, and they hadn't appreciated the kind of importance of that in the sector too. So I think there's a big piece for us to look at about the importance of those kind of additional roles and also soft skills in life sciences as well. And then just one final point as well on, so the GLAs, you're probably aware, are setting up sector talent boards at the moment, which will have employer representation, and it's basically about trying to get that direct line. It's existed in previous iterations before, but about getting that direct line of intelligence from employers into the GLA, into so that they can then direct their commissioning of support services to make sure that the right training and kind of education provision is being put on in colleges in particular to get people into jobs in the sector. So we have representation on that interim board through King's Health Partners at the moment. So there's an established link there and a channel. And I think I would urge, if you get any intelligence from your networks about specific needs, please do kind of feed them in, because we've now got that route in. We're also looking at the possibility of SC1 being involved in the hubs, which are essentially the delivery vehicle for those sector talent boards, which will be commissioning some pilot activity across London to address some of the needs that have been identified. And again, I think if there's intelligence that you'd like us to feed in through those channels about particular needs, please do just let us know, and we can make sure that that's represented.
Great, thank you so much, and thank you for the presentation and the great work you're doing. We'll look forward to hearing more updates from you of SC1 about what it's doing in the community. Thank you. We're running fast out of time, and I've been enjoying the conversation so much. So I'm now looking at my time. So what I'm going to do, I'm going to move the agenda around a bit. So for the 2 verbal updates, I'm going to keep it at the end, if that's okay. And I'm going to ask the Health Protection Annual Report to come forward. So Sarah, your exciting reports once again. Can I just ask you to do your presentation within 10 minutes, and then we'll take questions after that. I know the report is very packed, but if you could just condense it into 10 minutes, that would be really appreciated.
Yes, of course, we'll try. Thanks very much. I'm Sarah Robinson. I'm a Public Health Programme Manager in the Public Health team here at the Council. I'm Bruna Boscaini. I'm the CEO of VIRMO, that's the Indo-American Refugee and Migrant Organization. Just very quickly then. Oversight of health protection in Southwark is via the Health Protection Board, a subcommittee of this Health and Wellbeing Board, and chaired by the Director of Public Health. It's a multi-agency partnership with various groups and teams reporting into it, as you can see on the left. And this annual report hopefully shows you the kind of breadth of health protection activity that's happened over the year. It covers work delivered across the system, so by our own public health team, environmental health, emergency planning, social care, ICB, UKHSA, NHS and VCS. It's got all the sections you might expect in our health protection annual report. They're listed in the icons up there. I won't go through those. Importantly, it also includes a section summarising the new UKHSA inequalities report, and then also a section on some of our own local work that specifically tackles some of the inequalities in our borough. And I'm delighted that Bruna has joined me today from Irmo to speak about one of these projects with our Latin American community. So we'll come on to Bruna just in a minute. I just wanted to really quickly highlight some of the really varied, important work that's in the report that's happened. It's a real snapshot. Emergency preparedness, we've played a kind of key leadership role in the development of London-wide local health resilience partnership pandemic framework. That's a mouthful. And that includes a kind of detailed review of the roles and responsibilities of organisations in a pandemic situation. This was tested during exercise Pegasus and will inform local planning going forward. Another one I would like to highlight is the publishing of a hot weather and health JSNA, with the recommendations of those being taken forward. Loads of recommendations there, and we're working really closely with the climate change team on that. For screening, we have included questions around cancer screening in the NHS Health Checks programme, and this reaches 6,000 residents annually, so it reaches a large number of our residents. Various activity around sexual health, HIV point of care testing, condom distribution scheme, and vaccinations. A lot of work in vaccinations continues. I wanted to highlight our amazing health outreach service. It's delivered a really high number of vaccinations over the year by taking that kind of messaging and delivery out to residents. And then lastly, I just wanted to mention that there's a London-wide memorandum of understanding that's been signed across London, and this is about the management of kind of complex multi-agency outbreaks and incidents. And we've played quite an active role in the development of that work, and we're going to carry on trying to kind of embed that within people's work across London. In terms of communicable disease control, a lot has gone on, and I wanted to pass over to Bruna now to showcase one of the projects we're involved in that we're really excited about, the point of care testing for the Chagas disease.
Fantastic. Thank you, Sarah. Okay, so I introduced myself already, so I'll go straight into speaking about IRMO. So we are a community-led organization. We work mainly with Latin Americans, but other Spanish and Portuguese-speaking migrants as well. To give you an idea of our reach, we reach over 4,000 people every year, and last year alone, we supported directly 500 SODRC residents. The way in which we do this is by providing culturally sensitive wraparound support, always in community language. And then just briefly mention the areas that we work on. We provide advice on immigration, welfare, and housing. We also have a very strong focus on access to health, and we've been providing support in many different areas in the past few years. We have a program on education, training, and employment for adults, and finally a program for children and young people with a big focus on education and also access to employment for those that are older. And of course, we do all of that, and we try to use this evidence that we produced to inform our advocacy, research, and campaigns effort, always with a very clear focus on tackling the inequalities that the migrant communities that we support face. So very briefly on Chagas, I'm far from being a specialist, but being Brazilian, I do have heard about the disease probably much earlier than any of you imagine. So Chagas disease is caused by the parasite Trypanosoma cruzi. It's mostly spread by triatomine bugs. They are also called the kissing bug, but it can also be transmitted orally, vertically during pregnancy and birth, and through blood or organ transplants. It's endemic in 21 Latin American countries, and over 7 million people worldwide are estimated to be infected. It's important to highlight that it's known as the silent killer, and that's because it can remain asymptomatic for decades, and with 30% of the people with chronic infection then later on developing complications that can include, for example, heart failure later in their lives. Great. So why does this matter here in SODRC, right? I guess it matters because Latin America is a huge community in SODRC. So it's estimated that we have 14,000 SODRC residents that were born in a Latin American country. Of course, we're not including those who are born in the UK, so the community is certainly wider than that. That makes us the largest ethnic migrant group in SODRC, also in Lambeth. I won't go into all the details there, being mindful of time. But I guess it's interesting to highlight that there is an estimate 1.3% prevalence of Chagas among Latin Americans in London, but less than 5% have been diagnosed. So while we don't have the bug in the UK, vertical transmission is a growing concern. There is a diagnosed gap, and this relates to people being asymptomatic, as I just mentioned, but also GPs and frontline service very rarely being aware or screening or suspecting of the disease. And of course, the cultural and language barriers that Latin Americans and other migrant communities have to access health service will also be an issue when it comes to Chagas disease. And then I can briefly mention that we are here speaking about, for example, people not being able to register with a GP. There I mentioned that 1 in 7 are registered, or people fearing data sharing or even facing discrimination when they try to access health service. The implications are risks to people's health, certainly serious as sudden death, but we also have this missed opportunity of early diagnosis, and then health inequalities among migrant communities are just wider, and we see that this put a lot of pressure in health service in the long term. Okay, so how are we responding to this? So IRMU has been commissioned to deliver the first community-led Chagas points of care testing service in London. We worked very closely with the Sarah's team, but also with Chagas Hub. It was a 12-month pilot, and our budget was £40,000. All the positive cases that we had were then referred to the Chagas clinic for further testing and treatment. And just so you have an idea of the results that we achieved in this first year, we've been able to directly test, and these were tests that were performed by our team through a lot of training and support naturally from the Chagas Hub. So we tested 144 people. We had 21 positive cases, 29. Out of these 29 positive cases, more than 95% of them received support from our team to make sure that they would access then the follow-up help from the Chagas clinic. And we've been able to speak to more than 600 people about Chagas, so increase awareness among our community, and we hosted nearly 30 outreach events. The service has now been extended until February 2026, and it's likely that there will be a further extension of 2 years across Lambeth and Southwark. And I'm closing now. So just to try and share a little bit of why this model works. So all that we do at IRMU is culturally sensitive and trauma informed, and I know that they might have become buzzwords, but it's what we've been doing for 40 years, and we've been doing for 40 years because it really works. It's also done in community language, so that means as soon as people walk across the door, they will hear Spanish and Portuguese, they will be understood, and that takes us a really long way. It's built on trust, and this trust is a trust that they have on our organizations that we can then is then borrowed, I would say, by the health care service. So the trust that they have in IRMU is borrowed by the NHS and so on, and this is really successful. We also know that people that come to us, they come for a wide range of needs. So someone that have been tested for Chagas and might need a follow-up appointment because they tested positive, they very likely will be ISO students. They might have a housing case open to us. So there are several moments where there will be points of contact, and it makes it much easier for us to be able to get them through the whole journey to make sure that they receive appropriate care. We also know that 80% of the service users that come to us come through word of mouth. That means our reach goes far beyond the promotion and outreach efforts that we are doing. The community itself, it spreads the word quite well. It's also very cost effective. So we are talking about £116 per person tested, or £61 per person engaged. Everyone tested is also proactively supported by our team to access other service. And it was really interesting to hear Michael and I speaking about how you're trying to connect health and advice. And this is something that we've always understood well at IRMU, that people might come with a health need, but they will need support with housing, they will need support with immigration. And if you don't try and tackle all of those, it's very unlikely that they will ultimately be able to move on in a positive way. So I guess finally we can summarize by saying that we're increasing early diagnosis, we're reducing long-term risks, and we're also then contributing to tackling these wider health inequalities that Latin American communities face. I don't know how many minutes that was. Oh, that was. So you could see as an action.
Sorry, yes, that was a few photos.
Yeah.
And I won't
go through this slide, but thank you, Bruna. That was I think it's a really nice example of a really nice little project that we're doing that's has big impact. And I think it also highlights that kind of that close partnership working with our communities and also between organisations is really key to most of this health protection activity. And I will end there, but I wanted to note that the Health Protection Board is going to carry out a kind of self-assessment against the National Health Protection Assurance Framework in the new year. And this will kind of help the Health Protection Board to identify areas for kind of further improvement. So thank you.
Thank you. I mean, this was amazing work you're doing. I think I first heard of Chagas last year, well, a couple of years actually, when we were doing some work on this and how do we engage with the community. So great to see the outcome. So well done on your presentation. I know Maria is very happy. So thank you for that. Sarah, again, thank you for your just jam-packed report. I mean, the amount of work that your team is doing is amazing. And I said congratulations to the outreach service on the vaccination levels. I was quite, oh, wow, well done for that. So yeah, thank you. I'm going to take 2 questions if we have any. So yeah, Chris.
Thanks, Chair. It's probably more of a comment than a question. I think just thanks to Sarah and the team for all their work and to Mo and other organisations involved in this. I think it really highlights some of the challenges that we still face as a borough, but quite a lot of the work that's kind of underway to address some of these issues. And I think just for the board to see some of the connections as well, I think the Chagas work being led by Mo builds on some of the recommendations from the Latin American needs assessment, which was done earlier this year. So that kind of follow through from understanding the needs of our communities and the recommendations we're making on the back of that through to interventions and the outcomes that you see there. So just thank you to colleagues.
Thank you. And I'm going to stop at one question or one comment. So thank you so much. Thank you. So I'm going to go to the verbal update. I'm going to go to Darren and then Chris.
So just for context for this, so in June, I think it might have been July, the NHS 10-year plan was released, and in the 10-year plan there was a section that stated, in the future, a neighbourhood health plan will be drawn up by local government, the NHS and its partners, under the leadership of the Health and Wellbeing Board, and that will incorporate public health, social care, the Better Care funds. The ICB will then bring together these neighbourhood health plans into a population health improvement plan for their footprint and use it to inform commissioning decisions. So that's the context for this agenda item. I would have hoped to have brought a written paper, but what we're in the position at the moment is awaiting guidance about this neighbourhood health plan. So really, my verbal update is we're awaiting guidance. It was due to be out, so the guidance is due to be released from the Department of Health and the Local Government Association. We were told it would be out in November 2025. I suspect it's not going to come out this side of Christmas now. It's also probably worth saying there's whole sets of separate guidance that are coming out. So apart from guidance on the neighbourhood health plan, there is NHS England guidance coming out on the model neighbourhood framework and the neighbourhood health centre archetype. I mean, this is just a kind of surreal bit to end the meeting when I start to explain all the different public sector and NHS processes and the release of guidance. So NHS planning guidance has been received. Both the 10-year plan and the planning guidance has a lot of focus on development of neighbourhood health and care, on the development of integrated neighbourhood teams. So that's quite a critical part of our planning as part of a national health service that we have to comply with for the next financial year. And inevitably, and I mentioned it earlier on, that means that there's quite a focus really on the NHS elements of neighbourhood health at the moment. And I think the likely expectations are going to be that the guidance on the neighbourhood health plan will come out some point early in the new year, and that will be to inform future years of planning rather than 26, 27 in terms of neighbourhood health. That said, just to finish off, so it's not like we're not sitting around twiddling our thumbs waiting for guidance to come out. There is really a lot of going on in this space. So I was at a meeting ~8 this morning actually, where we were talking through the model for our integrated neighbourhood teams and the first stage of that model that we're hoping to launch starting really in April next year. And we've done a lot of work in the build up to that on agreeing our footprints for integrated neighbourhood teams and who will be the key kind of partners in that model of delivery. We brought together, I think, last Health and Wellbeing Board, both Evelyn and I sent apologies because we brought together all of the Health and Wellbeing Board chairs. Actually, Chris was there as well because we brought together public health leads to start to think about across South East London what do we want to see in the neighbourhood health plans, and how will the ICB's population health plans and delivery plans relate to that. And we do expect that the borough neighbourhood health plans will really be a continuation of our health and wellbeing strategies, and will have a strong focus on prevention and inequalities. And then just finally to say we have been selected across Lambeth and Southwark to be part of what's known as the Neighbourhood National Health Implementation Programme, which is quite a high profile programme, and the big focus of that is developing the model around how we're going to support people with multiple long-term conditions through our neighbourhood care. So, and I'll finish there. I'm going to try and bring back a paper, I think, in the new year once we start to get some of this guidance coming through.
Thank you, and thank you for explaining all of that in a succinct way. I'm going to task you, Darren, with helping us just keep keeping tabs of what's happening with the neighbourhood. So if for the next meeting, I mean, it could be a written or a verbal update. I think for the next few meetings, if we can have it as a standardized agenda, so we can understand exactly how things are moving, I think that would be helpful for all of us. And also basically where we can interact as well, that would be helpful. So thank you. One question on this, anyone?
I think that's really important, because I understand what you're saying, Darren, that at the moment this is very health focused, but there are lots of partners that want to support and be engaged, and it's, you know, it misses an opportunity if those partners aren't engaged at this point as well.
Thank you. Chris?
Thank you. Just briefly, conscious of time, so to update the board, we held a second Health of the Borough event on the 13th of November. This builds on the event which took place in March earlier this year. And as part of the board's work, I think there's been a strong kind of theme come from the board's development around wanting to engage more with our community and our community organisations in the borough working to improve health and wellbeing. The event that took place in November was themed around housing and health. One of the key aspects of the joint health and wellbeing strategy, and one of the key themes that came out from the event at the beginning of the year. Over 50 people attended from over 25 different organisations. Lots of really rich discussions around issues of co-location and how we can improve some of our, I guess, some of the themes that were coming through some of the early discussions, how that we tackle some of those issues around duplication and better coordination between our offer and our services. The team are just finalising a report with some recommendations for colleagues, which we will bring to the board at the meeting in March.
Thank you, and I want to thank you, you and the team for organising that. It was those who attended. It was a really rich discussion, and I think it just shows that sometimes we just have to just get in one room and decide where the problems are and just iron it out there and then. And I think that's what it demonstrated for me on that day. And this just came out of the first. The meeting, Health of the Borough meeting, which came out with so many different areas that I think we wanted to work together. So I know this is the first of a few more Health of the Borough meetings. So thank you in advance. And is that going to come to the next Health and Wellbeing meeting?
Yes, so we'll bring an update on the event that took place in November at the March meeting and set out a kind of how we want to proceed with some of these events. I think kind of trying to tie them more to kind of issues we've got, so they lead to tangible discussions rather than a kind of that was a nice chat, because I think there was lots of good connections made at the event in November about things to take forward and quite tangible action. So we want to keep that in mind as we go forward.
Great. No questions? Good. So on that note, just leaves me to say have a great Christmas. Make sure you rest, make sure you eat loads of cakes and everything, and we'll see you, God willing, next year. So thank you so much for all your hard work.